But, now that these protocols are well established, if your trauma system isn't really recognizing that your pre-hospital providers are giving the drug, and this is very applicable in the military too. If somebody's getting double the dose of TXA, and then you run into the concerns for seizures and the neurologic events associated with TXA. Anything over 2 grams for TXA given increases your seizure threshold significantly. So that might be something that we start to see if they're getting slammed with 2 grams in the field, and then as soon as they get to the hospital system, there's not good handoff, there's no card attached to them or something like that, and they get hit another again with 2 grams again, and they maybe aren't massively bleeding, so they're not losing that TXA, then it's possible that those complications could start to show themselves.
No, that's super interesting, because I had absolutely never heard of anything about seizures and TXA. For a very, very long time, it's been 2 grams, right? Initially, it was like 1 gram up front, and then we do like an 8-hour drip of the next gram. And, now it's kind of the 2 gram slam kind of situation.
When they look at it, pre-hospital administration of TXA for TBIs, they were saying, maybe the seizure threshold is a little higher when you're giving, push dose. And then the other complications with anytime you're pushing large amounts of TXA, you got to be worried a little bit about some transient hypotension too, which then in trauma, that's just going to lead to further resuscitation, more blood products, and you start to further cloudy and make your picture of what this patient is happening to this patient very difficult. Is it more bleeding, or is it the medications you're pushing that's causing hypotension?
Right. So that specifically, I called one of the like a helpline for like Pfizer or one of the companies that make, and I asked them specifically, like, what mechanism causes hypotension? Because, when you look at the insert, like all over, it's like may cause hypotension, like all over. It's like, well, like, I'm not very smart. Like, what mechanism does this work? And they said, like, there really is no mechanism. It just happened and we had to report. So, so it makes me wonder, whatever trial or whatever study they did to get this actual information to make the insert, was it a guy that, he had a street sign parked in his chest, we're throwing the kitchen sink at him trying to save his life. We happened to give him TXA as well. He got hypotensive and he died. Or is it somebody like, we're doing good work, things are coming back, somebody gives him some TXA, and then for absolutely no reason whatsoever, he became hypotensive and he died. So I'm wondering, is it really, causality, or is it just associated with badness because it's trauma and that's what happened?